a fast review for the radiology x-rays. When the radiology x-ray is given to you, you have to answer three important things first. Number one, which view, whether it is a plain x-ray or contrast x-ray, and which area. So for this, for example, if this x-ray has been given, don't see the right, left, superior, inferior, whatever is written on the x-ray, don't see anything. As a doctor, you should see the structures. Then you find out the shoulder joint, whether it is plain or contrast. Contrast means barium sulfate, barium minima, like that. Some contrast material will be given by orally or by injection. It will be given to your body, and that thing will be seen on the screen. That is called contrast. So here the plain x-ray is seen, means that is called plain x-ray. And which view, AP view, anterior posterior view. Antero is it means anterior, through which way the x-ray is coming, that is called anterior posterior view. Anterior means a rays will be coming anteriorly, the slide, x-ray slide will is placed posteriorly, so it is called as anterior posterior view. Number 2. And posterior anterior view we will take for the chest x-ray only. So for this and all we will take anterior posterior view. And which joint it is? It is a shoulder joint. So number 1, these three structures will be seen. And then number 1, you can see this is shoulder joint, and see these areas are all opaque and white. It means the rays are not passing through that. But you could see this area, the lung is seen, it is dark in color because it contains air. So the air transmits the x-rays, that's why it appears black in color. So the joint shows number 1, coracoid process, number 2, acromion process, number 3, acromioclavicular joint, number 4, head of the humerus, number 5, the neck of the humerus. The head of the humerus, here is the anatomical neck of the humerus, and here is the surgical neck of the humerus, and you can see the glenoid cavity here. So this is the supraglenoid tubercle, and here is the infraglenoid tubercle. This is the lateral border of the scapula. So these are the things you are supposed to show. And then if you go to the next x-ray, that is your x-ray of the elbow joint, AP view. This is the AP view, shows number 1, you just see the epicondyles. So how to answer? Plain x-ray, AP view, and shows the elbow joint. You could see the medial epicondyle, lateral epicondyle, and you could see the bones first. Okay, radius and ulna. Radius, you have the head of the radius, and this is the neck of the radius. This is the radial tuberosity, and here you can see this is a humerus, lower end of the humerus. So here you could see the capitulum, and here you could see the trochlea, what is present in the front, trochlea, capitulum and trochlea, and you can see the oligocronon process here. Okay, the superimposed, the trochlea is here, superimposed by the oligocronon process. This fossa is called the oligocronon fossa. So this is the lateral epicondyle, and this is the medial epicondyle. This is about the AP view. And then next, radius and ulna are seen. Then next thing is, okay, this is the lateral view of the elbow joint. So here you can see again the radius. Okay, this is the radius, and this is the ulna. You can see the oligocronon process of the ulna, and radius, head of the radius is seen here. You can see the trochlea. You can see the trochlea here, and this curve, this curve is called as coronoid process. This is called coronoid process, and this is called trochlea, and this is called the oligocronon process. So these three things you should see here, and then here this one already we have seen. The next thing is here. See, look at this. This is the plain x-ray AP view, shows the wrist joint. And what are the things you can see? Number 1, radius and ulna. Ulna never takes part in the wrist joint formation, and this you should tell. And then the carpal bones, how to read out the carpal bones. Okay, first radius. After seeing the radius, so go here. Okay, she looks too pretty. Okay, she looks too pretty. You'll see some other bone. Just hold on. X-ray. You have already seen the wrist joint W. Okay. Yeah, we'll see this. Okay, so here you could see that here we'll see Okay, the radius is here. So the bone takes part is scaphoid. She looks lunate. Tricutal. She looks too pretty, pisiform. Then the distal row, trapezium, trapezoid, both are here. Only two different shades are seen. And capitate, hook of hamate. See, capitate is the largest carpal bone. Lunate is the most common carpal bone, which is prone for dislocation. And pisiform is a sesamoid bone. Sesamoid bone, we'll ask what is sesamoid. A bone which gets ossified inside the tendon is called sesamoid. It gets ossified in the tendon of flexor carpi ulnaris. Then scaphoid is the most common bone prone for avascular necrosis. So this we will ask. Lunate for prone for dislocation. And the most important one, if you see the thumb, see the metacarpal. This is the first metacarpal. So you could see the small bone prominence here. That is also called a sesamoid bone. This sesamoid bone is present in which tendon, we'll ask. Flexor pollicis brevis is the answer. It is present inside the flexor pollicis brevis. These are all called metacarpals. These are all called the base of the metacarpals, and the upper one is called head of the metacarpals. That's all about the wrist joint.